question of vaccines yields a lot of strong emotions on both sides, but scientists and health professionals say it's imperative that children get vaccines, and that is why they can prevent so much common childhood illnesses. The little boy here being treated recently traveled overseas, and now his treatment here, as well as what a nurse did with his medical information, are in question. Inside the West Campus of Texas Children's, a baby boy younger than 3 years of age is fighting the highly infectious disease measles. The last thing his family probably expected was a pediatric intensive care nurse posting about it on Facebook. The first comments were made on a local anti-vaccine page. It reads in part, "I saw my first measles case this week. The kid was super sick enough to be admitted to the ICU, and he looked miserable. By no means am I changing my vax stance, and I never will." Further in the comments, the nurse wrote, "I'm not kidding that I thought about swabbing his mouth and bringing it home to my 13-year-old. Parents who use Texas Children's were shocked by the Facebook postings.
That's pretty frightening. I'm all for vaccinations, so I don't even know what to think of that.
I'm personally pro-vaccine, and my daughter's 7 months old, and I've gone to the doctor for all her vaccines.
Local health officials who are currently investigating the measles case says its rarity in the U.S. is directly attributed to effective vaccines.
Measles is such a concern because, one, it's preventable, right? We have vaccination that can prevent it. But number two is that because it is so easily infectious or transmittable to someone else.
Concerned parents posted the nurse's comments on the Texas Children's Facebook page, where the hospital quickly responded, "We are aware of this situation and have started a thorough investigation." Today, we're told the nurse is currently not seeing patients and that the toddler with measles is still being treated. So far this year, there are 7 confirmed cases of measles in Texas, making this case number 8.
Vaccines save lives. That's why we recommend the flu shot. That's why we recommend it, the schedule for children. That's why my own kids get their vaccines.
And we should note that Texas Children's has been very responsive. It is currently conducting an internal investigation. It says it is taking this very seriously, working with local health officials to properly report it as required by law. The nurse, meanwhile, we tried to reach out to her. We found her mom. She said no comment.